Hello, everyone. My name is Angela Hernandez, and my presentation today focuses on a growing challenge in modern healthcare, and that is the issue of language barriers for patients in the healthcare setting. If you've ever worked in healthcare for any amount of time, you likely have experienced the difficult situation of being confronted with a patient that speaks a different language than you do. Being in this position makes providing care difficult. The truth is that language barriers has always been an issue and continues to be an issue as people are moving to different countries and hospitals are seeing more patients that don't speak the main language of the geographical area. When doctors or nurses can't understand their patients, or when patients don't understand what their provider is saying, it creates serious problems. These problems can range from being misdiagnosed, can lead to medication errors, delays in treatment, frustration between patients and the healthcare team, and even patients losing trust in the healthcare system in its entirety. So, this isn't just about communication, it's about safety and quality of care. I had the opportunity to look at a few different studies on this issue, and all had the similar results. One study that I reviewed by Al Shamsi in 2020 showed that patients who didn't speak the dominant language were more likely to have poor quality of care. The study recommended using trained interpreters instead of informal interpreters like family members or random staff to assist with communication. Another study by Kanal in 2025 looked at Nepal migrants in Finland. Because they didn't have formal interpreters, a lot of them had to rely on informal interpretation by using, once again, friends or family members to help. And that only caused confusion and mistrust. Even though the information was being relayed in their native language, the information was not being translated properly. This study demonstrated that there was still a lack in communication with the proper medical terminology not being translated. This resulted in patients being less likely to go to the doctor or follow through with treatment. In Ghana, Ansah and Kluga found that providers attempted to assist with communication by using gestures or photo charts because they didn't have trained interpreters. This only resulted in patients still not understanding what was being communicated and said they didn't understand what was happening. And one doctor even said the communication was just 50-50. Patients were still lacking understanding in their treatment plans. It was found that even when healthcare workers did speak the language, like in the Tasai study in 2018, that they often don't know the medical terminology to communicate properly to the patients. They were still not prepared to explain important information to patients clearly, still leaving patients with a subpar understanding of their treatment plan. Luckily, there is good news. One study from Ogrodonic in 2024 showed that when a hospital started a trained interpreter program, especially for lesser known languages, it helped improve communication between patients and providers. There were fewer mistakes, patients were happier, and staff felt more confident caring for their patients. People have been migrating throughout history. So, why does it remain such a persistent issue? And why haven't we found an effective solution by now? The problem is a lot of healthcare providers still don't take language access seriously. They often just ask whoever speaks the language around to help, or they use family members to interpret. And let's face it, it's more convenient and quicker. But that's risky. Family members might leave out important information, or patients might not want to talk about private issues in front of their family members or friends. And staff who aren't trained might not explain things right or fully. This could lead to miscommunication and also violates patient privacy. We know that using formal interpretation improves accuracy, but can be costly and less accessible, and some hospitals don't think language services are worth the cost. But when you think about the risks, like medical errors or patients not coming back for further treatment due to lack of communication, it's a lot more expensive not to fix the issue. I believe there are three big things that can help fix this problem. First, every hospital or clinic should have trained interpreters available, either in person or on a screen, for all patients who need assistance. This should be provided from the moment they are in need of care and should follow them throughout their course of treatment. Second, we should train staff, especially bilingual ones, so they are confident in communicating using medical terminology. Not just how to speak, but how to explain things clearly, professionally, and respectfully. Third, we need to build trust with patients. Most people don't know they have the right to ask for an interpreter, or they don't feel comfortable asking for one. So we need more signage, more education, and staff who encourage them to ask for help when needed. Screening patients to determine if they need language services should be a normal part of the registration and/or admission process. To wrap up, language barriers are a major issue in healthcare. They're not just a communication problem, they affect how safe, fair, and effective care is. The research I found shows that using trained interpreters, giving staff proper training, and making patients feel supported can make a huge difference. This isn't something extra we should do. It's something every healthcare system has to do if we want to provide good care to everyone, no matter what language they speak. Thank you for listening.